Hi, in this video, I'm going to explain what depression is. The word depressed is thrown around a lot by lots of people, but in the clinical world, it means something very specific. And some people would benefit from knowing, what that actually means. So depression is clinically called Major Depressive Disorder. Sometimes we also call it unipolar depression, and that differentiates it from bipolar depression, which I'll talk about in another video. Usually this is one of the things that people notice that they're experiencing before they come in to see me. It's more recognizable in terms of symptoms and knowing that someone is feeling this way. But clinically, what depression means is there is a 2 or more week period of the following symptoms, and these symptoms have to last for most of the time during that 2-week period. So one of the symptoms has to be either sad, blue, or depressed or numb mood, or a loss in interest in almost all activities that someone used to enjoy doing. They also call it loss of interest or loss of pleasure. So one of those things has to be present. And then that in and of itself is not enough, because we can be sad or blue for a couple weeks for lots of reasons, and that's normal. But it's not normal when it comes along with a lot of other symptoms, and most of them are very physical in nature. So these include very low energy, like no amount of sleep is enough sleep, feeling physically slow or physically restless. It can kind of go either way. Frequent thoughts of death or of suicide, not really fear of dying, but thoughts about one's own death. Maybe I'd, be better off if I'm not here kind of thoughts. Maybe people would be better off without me kind of thoughts. And then sometimes it's, much more serious in nature, where people actually plan or want to plan to harm themselves or kill themselves. Another symptom is changes in appetite or weight. Some people gain weight, some people lose weight. It kind of depends on the person. Difficulty concentrating or making decisions. A lot of people feel like, every decision is overwhelming, like even picking out what clothes to wear for the day, simple things that when they're feeling well are no big deal. Sleep almost always changes. Either people sleep excessively, like 12, 14 hours, sometimes more, or they might have a lot of difficulty sleeping, which can involve difficulty falling asleep, staying asleep, or both. Another one is feeling very guilty or worthless for not really good reasons, like just feeling guilty for every little thing, either current or in the past. Depression likes to make people think of a lot of things that they regret that they don't normally think about when they're feeling okay. Subjectively, patients will describe like, it feels like I'm walking through mud, it feels like everything is too hard, it feels like everything takes away all my energy, I'm crying all the time, stuff like that. I feel heavy, I don't want to get out of bed. Some people don't get out of bed, sometimes for days. A lot of patients will describe not being able to keep up with their living space, like they're not cleaning stuff, they're not putting stuff away, dishes are piling up. It's hard to make food, they order out a lot instead. It's hard to take care of themselves, like showering, shaving, hair washing. A lot of people will describe negative thoughts, like just everything is kind of colored negative. It's like you're wearing a different color of glasses. Everything's gray and dark instead of normal looking. And a lot of people will say their first sign is like isolating themselves. Like they just don't want to talk to other people. They don't want to be around other people. They feel very lonely. And then some people describe it like they're in a fog or in a haze, or they have a cloud over them. And then, these symptoms have to either be distressing or impact functioning to be considered major depressive disorder. Depression can last weeks, months, years. It can come and go very often. It can come and go once in a lifetime. It can come and go, in a pattern or not in a pattern. I think a lot of people are more prone to it in the winter. And some people feel like it's kind of constant, but there's like worsening and improvement over time. So that's what we're looking for when we diagnose major depressive disorder.